Today we are going to discuss granuloma annulare. It's a very important topic. The main thing in granuloma annulare is the formation of granulomas. Granulomas have many proposed theories about the formation of granulomas, but there is no known pathogenic mechanism. One is about the immunoglobulin-mediated inflammatory response. Other is the delayed type hypersensitivity, type 4 hypersensitivity. So these are the proposed mechanisms. Next things which comes in your mind is induration. Induration can be in the form of papule, plaque, or nodule. The classical lesions is the annular plaque with the central clearing. Mostly you found granuloma annulare on extremities, means limbs. But there are unusual equations as well. You can find it in the ears, in the penis, palms, periorbital, and also trunk. Anywhere on the body it can be found in the form of generalized variety. Talking about the types of granuloma annulare, there are 4 major types. One is your localized variety, one is your generalized, one is your perforating, and subcut. These are the 4 main varieties of the granuloma annulare. Then there are some variants of the granuloma annulare. Among the variants, there are 5 main varieties. First is your papular umbilicated form on dorso of hands. Second one is your pustular, generalized, perforating granuloma annulare. Third is your follicular pustulous, then linear and patch. Talking about the associations of granuloma annulare, there is a mnemonic. That's a silly mnemonic, but you can remember this associations very easily by this mnemonic. This is Sudan maths. S for sarcoidosis, U for uveitis, D for diabetes, A for autoimmune thyroiditis, N for necrobiosis lipoidica, and then M for malignancy, A for adenoma of thyroid, T for temporal arteritis, H for hyperlipidemia, and S for scabies. Important thing is to remember is granuloma annulare is always a reaction pattern. So with this reaction pattern, there is always a trigger. That trigger can be an infection, that can be immunization, that can be vaccination, cephalectomy. Even vaccine can cause granuloma annulare. Sunlight exposure can cause granuloma annulare. Among the infections, there are sets of infections. You can remember it by 3 sets: HCV, HBV, HIV, hepatitis B, C, and HIV, human papillomavirus, Epstein-Barr virus, and parvovirus B19. Then mycobacterium tuberculosis, MTB, syphilis, scabies, and Borrelia. By these 3 sets, you can remember the infections group causing granuloma annulare. Then there will be sunlight, vaccine, cephalectomy, and immunization. Even insect bite can cause granuloma annulare. Talking about histology of granuloma annulare, there are 3 patterns of histological changes in granuloma annulare. One very important and very common topic change is the necrobiotic palisading granuloma. Then is your interstitial, and the last one is tuberculate or sarcoidoid. Common is granuloma, which I have discussed earlier. By the name of the necrobiotic palisading granuloma, you can remember there is a center of necrobiosis and there is palisading of histiocytes at the periphery. Among these histiocytes, there are also lymphocytes, and there are some multinucleated giant cells present. These are the cell changes. Next thing, very important thing in the granuloma annulare is mucin, which can seen by Elchian blue or the colloid and iron stain. This is formed in all varieties of the granuloma annulare. Next thing is there is metalloproteases, which causes alteration of the collagen fiber and decrease elastic fibers. In the interstitial variety, there is no central necrobiosis. This is not marked, and the histiocytes and lymphocytes are distributed perivascular distribution. And instead of central necrobiosis, the necrobiosis will be found between the collagen bundles. In the sarcoidal and tuberculoid, you can remember it by the presence of eosinophils and the mucin. So these are the histological changes of the granuloma annulare. Next, we talk about the treatment of granuloma annulare. Treatment is very simple: reassurance. Most granuloma annulare is resolved on its own by the 2 years. Other treatment options you have is cryo, you have intralesional steroids, you have topical steroids, topical tacrolimus, topical pimecrolimus, then photodynamic therapy, and systemics. Among systemics, you have metho, cyclosporin, antimalarials, fumaric acid esters, and many